Horace and the Messaging Miracle, a publication of DataMotion Health. Horace had health woes that were very much chronic. His doctors were stymied, could not find a tonic. It ruined his holidays last year, and worse, he was never quite able to get rid of the curse. He ran there for some blood work, scurried there for a scan. The results never made it back to his primary's hands. Referrals were lost, prescriptions weren't made. If they'd contacted him, oh, the time that he'd saved. Still, the thing that pushed Horace right over the edge was the breach that gave his data to hackers instead. Now his rhombosis was raging, his hacknoids inflamed. Must he cancel his holidays at Aunt Esther's again? So with brimstone and ire he called Doc Minty B. Cone. Even nursing heard cursing coming out of the phone. "Egad," moaned Doc Minty, "is there a solution that's near? There's no reason for this. I could so use a beer." "A solution need you?" quipped Tim Tam from IT. "I've got one that you'll love if you'll listen to me. It allows sharing data across the continuum of care, or the internet securely. There's nothing to fear. Each doctor would know what the other was doing. Could a reaction to treatment be Horace's undoing? The blood work results, the hacknoidal scan, with a click of the mouse, they'd all be in your hands. "Not so fast," said Doc Minty. "I know what comes next, a list of techno to-dos that will leave us all vexed." Tim Tam smiled broadly and smugly replied, "This can be done in the cloud. It's not pie in the sky. There are health ISPs to get it set straight away. No wires or briars, sometimes done in a day. Encryption with ease, no security keys. Works just like email. The whole thing's a breeze. And when you bring in the patient, when the info is flowing, better outcomes," cried Minty. "I know where you're going." "Exactly, good doctor," Tim Tam said with a smirk. "Patient engagement's the future." And he started to twerk. Minty had to admit it. This gyrating hipster was actually right. Then Tim Tam settled down and without further defiance, discussed without thrust how it helps with compliance. "What's that?" came a voice of the new CCO. "Our tracking not causing us any more woes?" And when he detailed the subsidies of meaningful use, the CFO burst in with the force of a moose. Doc Minty looked up to see a crowd gathered. More doctors, more staff, all worked up in a lather. He knew what to do as they joined him in chorus. "Secure communications, it's time we saved Horace." Then they raced down the hallway and into the eve as Tan wiped away tears with the sleeve of his tweed. They spilled out onto the lobby, into snow soft and white, crying, "Better health care for all, and to all a good night." Later next evening, Horace gave out a shout. A message from Minty out. An appointment was scheduled for Tuesday at 3. All his doctors were assembled and stifling their glee. "Horace," said Minty, "you were right on the money. We weren't on the same page, and while I know it's not funny, communication amongst us is now done securely. We've shared all the data and know why you feel poorly. Dr. Janacek started. I prescribed Noodler Spec, an anti-inflammatory that keeps hacknoids in check. But the cream that I gave to grow hair on your head can make them balloon," Doc Grizzly Bales said. "And the pressure resulting makes rhombosis rage," added a lab tech named Prudence, who preferred the name Page. Then Doc Minty leaned over and with a gleam in his eye, held a single pill out and said, "Now give this a try." One giant gulp later, old Horace was well. His rhombosis was gone, his hacknoids unswelled. He went home, packed his bags, and then hopped on a plane to celebrate the holidays at Aunt Esther's again. The family gathered round as Horace pulled up a sight, a new patient portal they viewed through the night. They saw all his scans, test results, and those files. They were mostly grossed out, but couldn't help smile. "It's just as it should be. I know what's going on." Horace even broke into a Festivus song, and his hair spilled out grandly as he tossed up his hat, frightening Aunt Esther and all her 8 cats. For Tim Tam, his advice had finally been heeded. The practice ran better, that's all that he needed. The staff was more efficient and now had a way to communicate securely and keep hackers at bay. As for Minty, he smiled, though he scraped away ice, climbed into his car and checked his mobile device, and there found a message from Horace of good cheer. Happy holidays, Doc, and a healthy new year. Happy holidays and a healthier new year from DataMotion Health, delivering secure health information where and when it's needed most.